I'm sorry that I'm unable to be with you today to participate in this very important and timely conference, so I would like to share with you a statement that I've prepared for this occasion. I speak to you today in my capacity as a member of the Global Commission on Drug Policies. This is an initiative that was launched a few years ago in order to try to foster a spirit of public debate on the important question of the obvious failure of the so-called war on drugs. This initiative actually was launched by international leaders and mostly political leaders from Latin America. Half a century of repressive measures, oblivious to considerations of public health, human rights, economic and fiscal factors, have not only failed to produce their intended results, but they've also caused massive unnecessary hardship. It's increasingly evident that the repressive framework was not 50 years ago and is not today anchored in credible scientific evidence. The impetus for change on the international scene has come in part from responsible world leaders and is now focused on opportunities that will present themselves at the time of the United Nations General Assembly special session on drugs that is scheduled to take place in 2016. Already, several countries, as well as several states in the United States, have begun to experiment with alternatives to purely repressive criminal models of drug prohibition, with regulation and harm reduction approaches that better address the issues of consumption and indeed addiction, while reducing the risk of the spread of infectious diseases and the many other undesirable consequences of blind repression. You will have opportunities at this conference to examine the scientific evidence that must serve as a basis for a sober evaluation of existing policies, as well as for laying the foundations of better ones. Policymakers in different parts of the world will respond, I think, to different rationales for reform. Some will focus on the economics of the illegal drug trade, including not only the loss in tax revenues, but also the monetary burdens of massive incarceration. Others may be more responsive to public health issues, but they are very few, in my opinion, that are likely to be mostly concerned with the need to respect human rights norms, unless there is serious mobilization of civil society actors urging an end to discriminatory policies and practices that are disproportionately harmful to the most vulnerable. This is, of course, at the heart of what a human rights-based approach is to the making of public policy. As most of you already know, the evidence is clear on the effectiveness of harm reduction strategies such as needle exchanges or safe injection sites in reducing the spread of HIV and hepatitis C among populations of intravenous drug users. It's particularly effective in prisons, where the rate of incarceration is systematically higher than it is in the general population. Meanwhile, mandatory sentences for drug offenders unduly increase the size of prison populations while denying inmates access to measures that would decrease the risk to their health. Current Canadian policies at home and Canadian advocacy internationally fly in the face of scientific evidence and the human rights obligations that should guide and indeed should bind the government to more effective and more humane approaches. Aboriginal people, already overrepresented in prison populations, are also disproportionately affected by repressive policies that reject the benefit of harm reduction strategies. Women serving long sentences for drug trafficking offenses are rarely the ringleaders of criminal networks, and yet the social cost of prolonged incarceration for women, for Aboriginal people, for youth in particular, is immeasurable, not only for them individually, but also for their families and for their community more broadly. These and the many other devastating effects of repressive drug policies that have been more or less the norm worldwide for decades could be overlooked if they were outweighed by demonstrable benefits of repression. But this is not the case. Worldwide prohibitionism has failed. Countries of consumption have been unable to curtail the demand. Countries of production have seen their economies and their social fabric devastated by criminal control of drug markets, and countries of transit have been drawn into the increasingly violent methods of both traffickers and law enforcers. And the boundaries between all three, countries of production, consumption, and transit, are increasingly blurred. You will have the opportunity at this conference to explore sound alternatives to blind repression, and I think it's important foremost to remember that the status quo should not be presumptively the best option. In fact, I think we must overcome our addiction to repression. In the field of others, in fields other than drugs, fields of control of all kinds of dangerous substances, the norm is regulation, not absolute prohibition. If it were to be introduced today for the first time, the model of absolute prohibition in the field of drugs would be seen as the most radical, marginal, and far-fetched idea. In contrast, a regulatory approach includes quality control of production and distribution, proper licensing and taxation, as well as marketing and consumption restrictions. Criminalization should only play a small part in the broad scheme of control of dangerous substances. Here, so far, it occupies the entire field with meager results and at a terrible cost. Canada could and should be a leader for change in a knowledge-based articulation of public policies informed by values of human dignity and respect. I urge you to use today's opportunity to move the Canadian agenda and ultimately the international one in this direction. I thank you very much for your attention and also for your engagement in this important issue.